I want to welcome everybody to the Resident and Family Support Council meeting that we hold on the second and the fourth Tuesday of every month at 3 o'clock East Central Time. My name is Lee Moriarty, and I am the Deputy State Long-Term Care Ombudsman. And we have been hosting these meetings now for 5 years. And we started these meetings through COVID to be able to connect people together for services and empowerment while we were going through a very unsteady time in our world. So we started these meetings, and then we decided that we needed to start recording these meetings because not everybody can make it at 3 o'clock on a Tuesday afternoon, and we understand that. So we started recording these meetings, and they are on our YouTube channel. And I'm very proud to say we have over 100 videos on our YouTube channel now. Stephen is here, and he is the man behind the curtain who does a lot of the sharing of all the information that we talk about throughout the meeting. So he is here, and I see that he's already started doing some sharing of this for us. Karen, his cohort, and she starts doing some deep dives for us as well to get us information in the chat to make sure that we really do feel empowered. Because that's the purpose, right? We understand that this long-term care path is not something that's so easy to navigate many times. And because of that, that's why we invited Mary today to come and talk to us. Welcome, Mary. We appreciate you're here. And Mary's going to be talking with us today about essential caregivers and what that's all about. And how this came through and developed was actually because of what happened to so many people during COVID. Mary, would you like to just share a little bit, first of all, with who you are?
Yeah, I didn't actually mean to do any of this. This is not something I plan to do. I'm actually retired from local government. I was taking care of my mom in a long-term care facility when, like so many people, um, I was kept out of the facility in the interest of safety and infection control, and it lasted a lot longer than anyone thought it was going to. She was isolated for 202 days. She had advanced Alzheimer's, so by the time I got back in to see her, she didn't know me. She couldn't speak. She couldn't turn her own head. She couldn't swallow her own spit. She actually lost the remainder of her cognition in total and complete isolation. Um,
Oh,
the lockdown, as y'all all know, began March 12th or 13th, depending on what part of the state you were in. We went to see her March 12th. I picked up her laundry, said, I'll see you tomorrow. And the tomorrow didn't come for 202 days. It took me about 3 months to get mad enough to decide to try and do something. But like so many people, I felt helpless. I started with a change.org petition and got a lot of ridicule and criticism from people that said I wanted to kill Granny and, that whole thing.
mm.
And so I didn't expect it to go anywhere until it did. And then all of a sudden the petition took off. And so I wound up actually forming a group when I found Mary Daniel had started the original Caregivers for Compromise group. She started one out of her state, Florida. She started a national group, and then she encouraged the rest of us to start state groups so that it could be more localized. And I think I'm actually the only one that started a state group myself. I think Mary started the other 49 groups. Um, and in Texas, we were able to work with our Texas Health and Human Services Department. We were recognized as family stakeholders. They allowed us to participate in the development of emergency visitation guidelines. We became very close to our own ombuds, our own state ombudsman, Patty Ducaille. We worked very closely with her, not just on these guidelines, but also on our state statute and a lot of other legislation through the state. But we were able to get a statute passed. But the thing that makes Texas so different from everybody else, and the thing that is kind of what drives me, is we are the one and only state that amended our Constitution.
Mm.
Our residents have a constitutional right to in-person access. And when I start the slides, I'll explain to you why that is so important. But we are actually the only state that has done that. And because of that, we are the only state that has protections from some of these restrictions if and when HHS ever again decides to press that hold button on certain residential rights in long-term care facilities. And in-person access is one that they cannot do in Texas because our residents have a constitutional right. So they can't withhold Medicaid, Medicare funding. They can't do some of the things they can do in other states because we do have that constitutional right. But as I pull the slide up, I'll explain that as we get to that. But that's kind of my background.
That's great. And you know, that passion for it was your mom, you know, and I've heard that story. I started in the middle of the pandemic. I started this job and I just heard from so many people, and I see some of the people are here right now on this call today that were denied access to their loved ones.
Mhm.
And just their stories were heartbreaking. And that same story, they saw this decline in their loved one that they would have probably noticed. They would have noticed some decline or some medical issues that needed to be taken care of if they would have been able to see their parent, you know, see
Right.
their loved one, see their relative, um, see the person that they deeply care about, but they weren't allowed to, and so that was missed, or
I
because
don't
of, like
know
you
how many
said,
states also had this problem, but for a time, we were actually told that ombudsmen were not allowed in.
yeah,
Now, that did not last very long, but
exactly,
we had a short period there in the very beginning, that first 2 to 3 weeks, where they wouldn't even allow ombudsmen in.
yep.
And
Illinois
those
experienced the
caregiving
same thing.
decisions that family members made were being made by nobody. So a lot of those people suffered some irreparable damage and even death.
Yeah, and it's just so the need for this is so prevalent, and Illinois has done. So Mary's going to be sharing with us. Mary, she said she's out of Texas,
I know.
and Mary passed this in Texas, got this all going in Texas, and she's like she's not stopping there. So she's been involved federally as well. And if we could get the federal behind it, that means then every state, no matter what, has to be able to have essential caregiving as part of every person's individual right if they live in a long-term care community. At the end, I will go into a little bit more about what Illinois has done and share with everybody a flyer, which we will post on our website so that you can even print that flyer off, or you could pull it up on your phone and say to the long-term care communities, we need to do this for my parent, for my loved one, for my husband,
Mhm. Yeah.
all of those types of things. So I want to make sure that at the end that I do that for everybody so that you can understand the really the importance as Mary goes through and starts sharing this with us. Mary, if you want to go ahead and start sharing your slides, that would be
Okay.
fantastic.
Well, as I figure out this whole screen share thing, because
Hmm.
it's saying remove from toddler, I don't have any toddlers, so I don't actually know what it's asking me to do. Um, yeah, so not sure. Not sure
So
what I'm not
you
sure
if
what I'm
you
doing.
do you see
Let's see.
there
Ah,
it's sharing, you're sharing.
okay. All
And
right.
wait, I don't see anything yet. It just says you're starting to share. So
Okay.
sometimes it takes a minute. Here we go. We got it up.
You got me now. Okay. How do you see people on the side? And if so, how do I get rid of those?
No, I do not see people on the
Okay, good.
side. I have people across the top. Um,
Okay.
and that's just the participants. So if you can move those over to the top if you want, just by dragging them.
I
Um,
just don't want it to interfere with your ability to read the slides. Um,
yes, no, we can see the
okay.
slide.
So before I start, I do want to tell you what the Ombudsman connection is here, because ombudsman actually played a vital role in even getting a federal bill filed to begin with. So our original bill, which was filed back in 2021, was the federal bill. This was after we passed all our state stuff. Claudia Tenney, who's House Rep out of New York, filed a House bill. It was 3733. I don't know. I'm getting numbers confused. I'm old. Forgive me. But that first House bill was just on the House side, and it didn't go anywhere. It went, nobody did nothing with it. We talked it up. We published books. Our national group, which Carrie Lesdale is a really big part of, was really active. And we published a book that actually had, this is the most current one. I don't know if you can see this guy, but this
No,
is, hello, where did it go? Camera.
yeah, yeah, it
There we
kind
go.
of can do those types of things.
Yeah. So,
And I'll just
but there,
explain, Carrie is actually from Illinois, Some of you on this meeting may be aware of Carrie. Carrie came and spoke a couple of weeks ago to our group about what it's like to be the parent of of having a child in long-term care and what that all felt like for her during COVID, but as well as just giving her story. And that's something else that we've been doing this year is talking to families and having them share what some best practices, some just some information on how to help others navigate the system. And I'm really sorry, my cat is meowing really loud right now because she sees another cat outside.
That's okay.
So,
My rooster's crowing.
okay,
So
there we go.
we did these books, and there are stories from all 50 states of families, different lockdown stories, and some of them are just devastating stories. Um, but that first bill went nowhere. It was just on the House side. So at one of I think it was a NASOP meeting, I'm not sure what it was, but it was actually Mairead Painter who hooked up with my state ombudsman, Patty Ducaille. And next thing you know, I've got a joint phone call from the two of them saying, Mary, we've been talking and we just really believe there's no way this is ever going to happen unless Texas takes the lead on this, because it is Texas that has the strongest bill in place. It is Texas that so many other statutes were modeled after. And we just really feel like, Tag, you're it. And so what they really wanted me to do was get a bill filed on the Senate side to be a companion bill when we got the new House bill filed. So it took a couple of trips to DC to meet with the state senators. We did get Senator John Cornyn to co-author the bill that year, and I can't remember the number. It was 3733 was the first one. It was 86. What was it? 8331 the second time around. But we did get a companion bill in the Senate, and that was because of the work that or the phone calls that Mairead and that Patty made. And Mairead actually did a kind of a roundtable with me at one point in DC where we outlined the provisions of the bill for some of the legislators, and she helped with that quite a bit. So we've actually had active participation in this from our ombudsman. So it hasn't been all families. It hasn't been all anybody. We've had lots of different groups nationwide. The list of endorsements that we have on this bill include all kinds of family groups, all kinds of actually provider groups. We have a lot of provider support. You'll be shocked at some of it. But that bill didn't go anywhere either. So now here we are, third session in a row, with yet our third federal bill. This one is 6766. We do have yet another Senate bill, same Senate co-leads, same House leads. And I feel like this is kind of our last shot at getting this approved. A lot of us are going to DC next week, actually. We're going to just hit the pavement running. We're going to go door to door. We've been setting up meetings. We have a bunch of these books printed. We have other information printed. And our goal is to get it to markup, which is a fancy word for make them hold a hearing and take notes on it and tell us why they don't like it or why they do, and take public testimony on it. Let the public have an opportunity to have their say. And to do that, we are just going to have to go knock on legislator doors and say, please get a hold of Chairman so-and-so and ask him to move this to markup and hold hearings. So that's what we're going to do next week. And I feel like if we don't get it moving this time, I don't know that we're going to get it done, because I think people are kind of COVID weary. And that's the thing about this bill, is it is not a COVID bill. What makes this bill special, and I'll show you that slide as we get to it, is this is for any emergency. This is not just a health emergency. That original bill we did was specific to health emergencies because we were dumb and didn't know what we were doing because it was our first time out. Now we know what we're doing. This bill is for any kind of emergency, whether it's a natural disaster, whether it's some kind of national defense emergency, whether it's a weather emergency, flood, hurricane, mudslides, tornadoes, zombie apocalypse, alien invasion, whatever it is, if for any reason HHS says, gosh, y'all, we need to restrict the rights of long-term care residents just for a short period of time for safety and infection control, we can say, okay, that's fine. You're going to put those provisions in place, but we are entitled to make sure that our loved ones still have that in-person access to at least one person that they are guaranteed to in that 1987 Nursing Home Reform Act.
And Mary,
So,
that's interesting that you said that because we did experience some of the ombudsman did experience some of I'm getting some complaints from some nursing homes this past winter with RSV going around in their buildings and they were trying to deny some family members of visiting their loved ones.
yeah, and
So
they think they're autonomous and have the right to do that on their own now.
yes, yes.
Facilities believe that since they've been through this once, they don't have to wait on any kind of federal declaration or state proclamation. They think that they have on their own the right to deny in-person access, which they do
Hmm.
not have. We've
Right.
seen facilities deny access due to outbreaks of scabies, due to
Huh.
water main breaks, due to having a roof replaced. One of the things that is happening where we are here in Texas, we've had lots of protests due to all kinds of different issues happening in the world that are just, you know, really, really volatile right now. And here in Texas, one of those is immigration. And we have had facilities that have shut down visitation because of protests in the street. Well, I don't want people going in the facilities using the bathroom and cooling off in the hallways either, but you must allow me in there to see my loved one. So we've had to be very clear about what their limitations are, and the ombudsman have had their work cut out for them and have really had to educate our facilities. So anyway, let me get started with these because we're already at 17 minutes after and I talk a lot. So I already told you these are the authors of the bills and how that came about. So for 2 sessions now, we've had these same co-authors. And one of the things we as national team members have done is made sure that we are apolitical. When we meet as a group, when we have our online meetings, we have our Zoom meetings, we are not allowed to talk about politics. We're allowed to talk about long-term care issues, but everything else stays outside the door. So I don't actually know people's affiliations. And that's really helped us in securing what is called a bicameral bill, which is two legislators from each of the houses, two Republicans, two Democrats, two senators, and two House representatives. So it's what's called a four corners bill. We've got all bases covered, and it really helps us in selling this bill. I think the latest numbers we got was we had 131 House reps that had signed onto this bill and 30 something senators. So we are making progress, and this is the most hopeful I've been that we might actually see this bill move. One of the questions we get a lot is why do we even need this? This right is protected in the Nursing Home Reform Act. This is a right they all have. Another thing I've heard that might make your blood boil is CMS has denied ever saying that that visitation should be restricted. Y'all, we all have those provider letters that were issued that say limit visitation to end of life or to compassionate care. I mean, we still have those letters. So for CMS to deny that happened is pretty upsetting. But the other thing we have to try and remember is that these aren't the same people in those offices, and a lot of them are pretty young. A lot of them don't even remember COVID. They were still in college, so, or even high school, I don't know. But it can happen again, and it can happen again for any number of reasons. But HHS does have the ability under the law to push a hold on long-term care resident rights under Section 1135 of the Social Security Act, and they have the ability to do that if certain parameters are met. And one of those is national safety, which is, I think, what COVID fell under. So every state, all 49 states except Texas, HHS can still push that hold button on. And it is only our constitutional amendment that protects us from falling in that category as well. One of the questions I get from Texas is, whoa, wait, didn't we already do this? Why do we need it? So campaigning here in the state of Texas has been a challenge for this bill because people are like, you know what, guys, we've already done this. We don't need this. Well, they're right, we don't. but not everybody lives in this state. And so what we did do was when we authored the bill, and Senator Cornyn's office and Senator Blumenthal's office were really generous, allowing us to work very closely with them on the wording of this bill. We made sure that the Texas statute fits seamlessly into this so that it didn't minimize, reduce, abridge any existing work that we'd already done here in the state of Texas. So whatever is adopted in this bill, unless it changes when it gets to markup, right now cannot hurt anything we've already done in Texas. It could actually only help us a little bit. And all these slides Lee is going to make available to you. So if I'm going through them too quickly, it's just in the interest of time, but you'll have access to those. We as a group, Caregivers for Compromise, there's one of us in every single state. And we needed to make sure of these three things. And one of them is we just needed to preserve a resident's right to in-person access. One of the arguments we got from some facilities and some providers groups was that we were creating a new right for long-term care residents. We weren't doing that. We were just trying to preserve a portion of their existing right in the event they were abridged or denied for some reason. We want to make sure the bill is not subject to those waivers, and we want to address any barriers to in-person access in both states that have existing essential caregiver legislation and those that have none. There are states that have existing essential caregiver legislation that's not really essential caregiver legislation. And I don't know if you have anybody in here from out of state, but I'll give you New York as an example. They have an essential caregiver bill that they were very, very proud of. I'm not proud of that bill at all. One of the things it allows those facilities to do is if they determine, for example, my mother, if they determine that a resident would not benefit from the visit because that resident was too advanced in their mental condition, or was going to be aggressive, or it might cause some kind of issue in the facility, they have the ability to deny that visit. Under their statute, they have the ability to say, I'm sorry, this person does not have the mental capability to appreciate the gravity of the visit and what this might cost to other residents in the facility. The risk to infection control is just too great to allow that person to have a visit. But the person over there who can use both arms, both legs, and can complete a sentence, yeah, they can have a visit. And to me, that's discrimination. And that's a bill that actually passed in New York. So this bill would actually level the playing field and no longer allow them to do that. They would have to allow every resident, regardless, whether they can utter a complete sentence, swallow their own spit or not. Every person is entitled to at least one person to access them, because there's just simply no other way to make sure that their meds are getting done, that we're protecting them from the potential for abuse and neglect. I mean, the ombudsmen aren't there every day. The ombudsmen are only there when you ask them to be there, and sometimes they're even kept out. So that brings up another question. Does this bill apply to ombudsmen? No, they are not essential caregivers. They're entitled to be there, period. So this is not an ombudsman bill. This is about a resident's right to in-person access as they are permitted under federal law. This just explains what those Section 1135 waivers are that I was telling you about. And these were the goals that the authors had. One of them, and this was the Texas senator, he wanted to make sure that they preserved the state's authorities when they issued the bill. And that's what I was explaining about, just making sure we don't infringe on anything that's already in place. But also, he didn't want to hand all authority over to the federal government because they moved too slow. And I'll explain that when we get to that point. So this is where we were. If you look in the left column, when we did our first bill, I already forgot the number, 3733. This was our first bill. We wanted everything that was possible, the most idyllic, perfect possible ask that we could send. So that bill that we put out was our wish list, and this is our most perfect bill. And yeah, it didn't go anywhere. The provider groups just shot it down in flames. American Healthcare Association kind of laughed in our face. And then now looking back at it, yeah, I can kind of see why. This next one is what we did next. What is plausible? What can we realistically ask for without compromising our own goals? And that's what we put forward. But the reality is we have to be doing what is actually passable. We still need to do that middle part. We don't need to compromise our goals, but we still got to be realistic about what is actually passable. We can't do that left column. We're not going to get everything we want. And that's where we get a little pushback from some family members is like, well, why did you do this? Why did you do that? Well, that's because it's not going to pass otherwise. And let me just say this, we do not believe a bad bill is better than no bill. I would rather have no bill than a bad bill. So we're not going to put anything out there that we think is bad or harmful to long-term care families. Anything that allows a facility to say that you can only visit 15 minutes once a week, yeah, I will die on my sword fighting over that one. But we do have to make certain compromises, and I'll show you what that is when we get to that slide. We've also had to let everybody and their dog look at this thing. So not only did both of the House representative offices and their staffs look at it, and both Senate offices and all their legislative councils, but we had to get feedback from CMS, we had to get feedback from HHS, we had to get feedback from stakeholders, from committee members, and we're not getting a lot of feedback from the committee members yet. We've gotten some, but since it's technically not on a calendar yet, they're being really cautious about how much information, they give us, how much opinion they give us. Lots of legislators are giving us their questions, but not so much their opinion. And then whoever those legislative staff members and councils share it with, lots and lots of people have looked at this bill. And fortunately, this time around, we have not gotten a lot of negative comments. We've gotten mostly just a few questions. Some of them are pretty dumb, like the one I told you. Does this apply to ombudsman? No. So some of it's just simple yes and no questions. This is one that's not going to be hard for you, but this slide is in there because I used it the last time I talked to family members. It's just kind of explaining the hierarchy of federal law, state law, local law, and regulations as opposed to a statute, and how all those layer together. Some of them don't understand that, federal laws supersede state laws. But if state has a law and federal has a law, you have to comply with the more stringent of the two. So, for example, here in Texas, if my bill says you must allow in at least 2 essential caregivers, and the federal law says you must allow in at least 1, they got to allow in 2 because Texas state law says 2. But if both say at least 1, they can allow in 1 or they can allow in 2, one or the other. But it can't conflict with state law, or federal law. So local laws can't create a law that says, oh, well, we have a law that says there are no essential essential caregivers allowed. You can't do that. It can't even be grandfathered because federal law is supreme and rules, and because these are Medicaid and Medicare funded facilities. So it's a little complicated for families to understand some of this. I know it's not quite as hard for an ombudsman, but it does get a little tricky when we're talking about the nitty gritty inside the bill, and we have family members that are a little upset because they think that they're going to lose something that they already have, when in fact they're not. They're going to benefit from the bill. These are just the facilities that it would actually apply to. As ombudsman, you know that anything that amends the Social Security Act that only applies to Medicaid and Medicare facilities is not going to apply to a private pay assisted living facility. So any private pay assisted living facility that, it's private pay, it doesn't receive federal funding, is not under federal oversight. So it's not going to fall under these guidelines. That kind of bums me out because here in Texas, our requirements do apply to all facilities. So that is a protection that we will always have in this state. that some other states will have and some will not, because some of the statutes that have been adopted in other states do apply to all facilities and some do not. And our constitutional amendment applies to every single facility regardless. It is not it's not tied to federal oversight because we're a state. We don't tie things to federal oversight. So it is a little disappointing that we were unable to make this apply to private pay facilities. And then these are the definitions in the bill because we've had some questions about what's the difference between skilled nursing and nursing facilities. They're just named in two different parts of the bill. Some of them are, one of them actually applies more to diseases and injuries than the other one. And y'all are free to go back and look at that. Okay, so the nitty-gritty of the bill. Each resident or resident representative, if that resident is incapable of making that decision, or that resident has a legal guardian, may choose one essential caregiver. One of the questions we had was, well, what about somebody that has a medical power of attorney? They do not surrender their right to in-person access just by having a medical power of attorney. So that resident can still choose their own essential caregiver, unless, of course, they have decided to let that representative choose it, or they are simply incapable of making that decision and a family member needs to do that for them. This other section right here, we've had a lot of discussion about this one. Essential caregivers are not comparable to staff members. They do have to meet some of the infection control protocols and other guidelines that that facility puts in place for their own facility, but they are not staff members. They cannot be forced to do anything as a condition of being allowed to see their loved one. And we don't call them staff members. They are not to be compared to staff members because they are still visitors. We don't like calling them visitors because they're caregivers, but as opposed to being a staff member, they're a visitor. As opposed to being an outsider, they're caregivers. They're vital to the health and safety and welfare of that resident. This is another thing. A lot of facilities don't want the resident to be able to amend their essential caregiver designation, but that can be done at any time. And the reason for that is because, you have family strife, you have illnesses, you have deaths. The essential caregiver that family member designated may not be appropriate all the time. They may go on vacation. There may be a million reasons why that designation needs to change, and they don't need anybody's approval or permission to change that. And there doesn't need to be it can only be done every 60 days kind of thing, which is in some of the statutes out there. So it can be changed anytime. This one here, they must follow the safety and infection control policies put in place within the facility within reason. You can't require anything that goes against state law. So if you have in place a state law that says you can't force someone to take a certain vaccine, or you can't force somebody to take a certain type of training class, then that facility doesn't have the ability to put that in place. If no such law exists, then that facility can certainly do that. And again, that's where it's going to be real important for an ombudsman to know those things, because we family members just don't. Essential caregivers who fail to comply with policies can be denied visitation. They have to be given a warning. They have to be given an opportunity to correct that behavior. And the reason they can be denied visitation is we do have some bad actors out there who just like to stir up trouble for no good reason. This is not to punish anybody for showing up 5 minutes later than they said they were going to show up. So it's going to take an awful lot in order to justify this, because there's also going to be an appeal process. Any access denial can be appealed. And the essential caregivers provide whatever degree and type of assistance the resident and or the essential caregiver determines is needed. It can be emotional, it can be physical, it can be companionship, it can be sitting there staring at them. That is up to the resident and or the essential caregiver. There are state laws out there that say an essential caregiver must provide physical care. That's not something that we have a right to do because that flies in the face of federal law. Federal law does not put any such conditions on a long-term care resident's right to in-person access. So that's not something that we want to infringe on in this bill. These points are all explained in a little more detail in the next slides. I already said it's bicameral, it's bipartisan. It gives long-term care residents in-person access to at least one person of their choosing at all times. It applies to all emergencies, whether it's local, federal, or state. It applies to all emergencies. It applies to all types of emergencies, any type of emergency. Here's the one that gives a lot of people heartburn, this one right here. Facilities do have the ability to pause for 7 days during the period of an emergency. And that is so they can either sanitize or cohort or, gosh, we only have 2 staff members for 150 people. Let us call in a bunch of PRNs. I don't know what that reason might be. But here's the thing about that is so glorious compared to the Texas one. The Texas one says they can do that every 60 days. This one is the entire period of the emergency. And unless you have a crystal ball, you had no way of knowing that HHS was going to limit visitation from March of 2020 until November 12 of 2021. So they would have only been allowed that 1 7-day pause during that entire period. And once they used it up, it was gone. It's over with. You don't get another one. You can apply for an extension, but you may not get that. They're going to be very cautious about denying resident rights. We have heard from this administration, as we've asked for comments, that this is just never going to happen again. We're never going to put another pause on visitation like that. Well, if that's the case, then you don't mind this provision that says they can only do 7 days and no more. If you think it's never going to happen again, it's never going to happen again. Enforcement and survey authority rest with the states. This came from our Texas legislator who wanted all authority to rest with states because he said if you have to go through a federal complaint, it's just going to take too long and it's just not going to get resolved. He didn't want to take any negotiating ability away from the ombudsman. He didn't want to take any kind of ability from the states to cite these facilities. He didn't want to interfere with that in any way. HHS will establish the final rule for the appeals process, and then there's a penalty for noncompliance. These slides all go into a little more detail about each one of those points I just made. I already explained to you what bicameral and bipartisan authorship means, and why there's at least one essential caregiver. States can allow more than one. They can allow 4 if they want to, but they have to allow at least one. And states do have the ability to require 2 or require 3 or require 10 or require unlimited, but they must require at least one. I already explained this to you. It applies to all declared emergencies. Some of the states have essential caregiver guidelines in place that only apply to locally declared emergencies. New York is one of those. It only applies to an emergency declared by the city of New York or the state of New York, depending on where you are. And so a federal declared emergency, their essential caregiver bill does not even apply to that. If HHS declared an emergency today and said visitation is restricted, and this bill was in place without this provision, the state of New York would not be required to let anybody in under their statute. Their statute only applies to themselves. Federal law doesn't even apply in their essential caregiver bills, which to me is kind of ludicrous. Why do you even have one? But It's one of those pull the wool over everybody's eyes things, I feel like, that got slipped in probably by a provider group. I'm not sure, but it it only applies to a local or state emergency. It applies to all types of emergencies. We talked about facilities shutting down for all kinds of reasons. This is not just a health emergency. Of course, it includes health emergencies, but this is any emergency. And that's a mistake we made with our very first bill, is it was tied to health emergencies. But in the state of Texas, our constitutional right is any and all reasons why a facility might restrict in-person access, any declared emergency at all. And that's something we wanted to make sure we put in the federal bill. This pause for 7 days, we've been accused of it being a loophole for 7 days on, 7 days off. Nope, it's one time. You get to do it one time during the entire course of a disaster or a declared emergency, or let's say there's World War III and all facilities have to be shut down or whatever. You don't know how long that's going to last, so if a facility applies for that 7 day pause, they better make sure that they're willing to use that up, because that's their only one and get out of jail free card. The bill is very broad. It's meant to help with existing statutes that need to work within the bill, but it's also meant to fix any bad statutes that are out there that basically operate as no statutes at all. We have one state that had an essential caregiver bill adopted that only applied to a very brief period, like 30 or 60 days. And I can't remember what the actual scenario was, but then there was some kind of recall election or something, and the whole bill was recalled because it was tied to the person that was being elected. And I'm like, that made no sense to me. This just explains about why Enforcement and Survey Authority is resting with the states. Non-compliance is going to begin at the state. It doesn't mean it's never going to go up to HHS or CMS, but it will begin at the state. It gets escalated because this is a federal bill and it is tied to Medicaid and Medicare funding. So it does begin at the state, but non-compliance does risk not just a state citation, but a federal citation that does risk their federal funding. So the bill does have some teeth into it. And we hope that that bottom part, that it minimizes conflicts with existing or future state rules and regulations, keeps it from causing any kind of problems with anything, because we don't have crystal balls. So we're hoping that it's broadly written enough that anything in the future that is written will kind of seamlessly fit inside that. HHS, once this is adopted, and when I say once it's adopted, I'm hopeful that it will be, they have 2 years to finalize their process on the appeals. That takes too long. That doesn't mean you have to wait 2 years to appeal. If there is indeed a lockdown at some point and we have to start filing appeals immediately, they have 2 years to do it, unless there's a lockdown, and then they better get busy with their pens and start writing something, because decisions have to be made within 48 hours. Corrective action plans that prevent the recurrence of violations have to be established within 7 days if a facility is found in non-compliance. So there are some pretty strict penalties here. That $5,000 civil penalty, it's not to exceed $5,000, so it can still be a pretty puny penalty. I wish it was a minimum 5,000, but I do like that number. And states have the ability to expand that. So a state has the ability to say it's a minimum 5,000. Okay, and that's about all I have on the slides. I did want to just mention, since we're going to how do I unshare this? Unshare.
I can take it away if you want me
Yeah,
to.
take it
Okay,
away from me, because I'm Zoom ignorant. Okay.
got it.
So we're going to DC next week, and what you can do to help us in the meantime is, I don't know their names, I had to write them down, but we have some we have some pretty pivotal people in Illinois that you can contact that would help us. Um, Robin Kelly is on Energy and Commerce Health Subcommittee. Robin Kelly has co-sponsored the bill, but what we also need is for the ones that have already co-sponsored the bill to contact Jason Smith, who is chair of Ways and Means, or contact chair of Energy and Commerce in this case, and ask the chair to hold hearings. Now, we are primarily focusing on Ways and Means. So if Robin Kelly is your representative, by all means make that phone call. But we are primarily focusing on Ways and Means because we got some really good news yesterday that we're really hopeful that the bill could be in a position to actually be put on a markup calendar. So it's important that we go ahead and ramp up that pressure on Jason Smith to put it on the markup calendar. The
So
chair
let me
of,
just interrupt that, Mary, because I
yeah,
want to make it clear because I'm not quite clear myself.
yes.
So you're suggesting that we reach out to Jason Smith?
Yes, I have some other names. There's two committees that it's
So
sitting in.
Karen, if you
One is
guys could start looking for that contact information there, that would be
yeah.
great. So that we could put that into the
Hey,
chat.
Lee,
Karen.
I put in a link for Illinois residents on how to find their elected officials.
Okay,
Excellent.
perfect.
So
Thank
there are
you,
two
Karen.
committees this bill is sitting in. One is Energy and Commerce, and one is Ways and Means. It's in the health subcommittees of both of those. But unfortunately, the chair of the health subcommittee can't move it to markup. It has to be the big honcho of that committee, which is really not making sense to me, but that's how it is. So Um, Energy and Commerce, we don't have a lot of hopes of it moving in Energy and Commerce, but we're working on that committee anyway. So Robin Kelly is on Health Subcommittee. So if that is your rep, go ahead and make that call and say, what can you do to help us move it to markup? The other Illinois names are Danny Davis and Darren LaHood. They are both on Ways and Means Health Subcommittee. Um, Danny Davis has co-sponsored the bill. Darren LaHood has not. So when you call Danny, say, hey, I've seen that you co-sponsored this bill. Could you please call Jason Smith, the chairman of Ways and Means, and tell him we really need this to get put on a markup calendar. We really need this to be put on, given a hearing. And Darren LaHood say, hey, I notice you have not signed this bill. We really could use you to co-sign this bill. And while you're at it, let's give Jason Smith a call as chairman of Ways and Means and tell him we really need you to put that on a markup calendar. Because what we're hoping we can do, and here's where I've got some promising news for this bill, is that there are several caregiving related bills about helping with caregivers with funding and barriers to caregiving. And we're hoping we can lump all those bills together and have a hearing on all these caregiving bills, including ours, the essential caregiver bill. And that's where I think we might actually see some movement on the bill, which makes this year different than the other legislative sessions. So that's the promising news I want to end this with, is that there is hope. But you know what? We have all got to have the courage to just pick up that phone. Don't email them. Pick up the phone. Say, my name is so and so. I'm in your district. Or my name is so and so. My mother is in your district. Or my name is so and so. My father died in your district. Whatever it is that fits, and say, we really need your help. You can even say we have some constituent family members in our national group that are going to be in DC on these days, which is June 3rd and 4th. Would you be willing to meet in person with them if you want any details about it? They'd be happy just to drop some information at your office. You don't even have to talk to them. They'll just drop some information by at your office. And if somebody responds to you that they are interested, need more information, want to talk to one of us, you can email me.
Okay.
I'll put my email, or actually Lee can put my email in the chat. You can go to my website, the Texas Caregivers for Compromise website. We're going to update all the information on there shortly. It's all current, but I'm going to actually put the paperwork, the flyer, the whatever you want to call it, we've got a one pager and some other stuff that we're going to take with us. We're going to take these books. I have a book of just everything we went through in Texas. I know it's hard to see, but in Texas, we spent years, we did traveling signs that Carrie kind of copied us in Illinois. We have all the different stories of our families in here. Well, where did it go? There it is. Well, anyway, trust me, there's another book. And then and we have our very first book, which I'm going to take as well. And that's the one that our legislators used in their hearings when they passed our resolution to call for the election for our constitutional amendment, which was passed by our voters 88%. So it didn't pass by a small margin. It was 88%. So, okay. Questions? I know I rattled off a ton of stuff real fast and I talked too fast and I'm so sorry about that. But is there
No,
anything
that's
I can help you with?
Mary, I think we all understood the urgency. So that's the other piece is when do we need to be doing this by? Is this something that we need to do tomorrow? Or
Yeah,
can it wait?
yeah,
Okay.
because June 2nd,
ASAP.
I'm getting on a plane. June 3rd, I am hitting the pavement with sneakers on. We have two from Texas, one from New York, one from New Jersey, and one from Florida that are going. Our Illinois lady really wanted to go, but she just
Yeah.
had some surgery. Um, but it's a very expensive trip. It's not something we can all do. I mean, this is like my fourth or fifth trip to DC on this bill, and I'm tired.
Yeah.
But I think I feel so good about it this time that I just really want to give it this last final shot. And so there'll be five of us knocking on doors, dropping off books, dropping off cards, dropping off information, asking them to chat with us, and trying to get more co-signers. Here's the shocking thing, y'all. All this work we did in Texas, y'all might as well just hold on to your seats. I've got 38 congressional reps in Texas in Congress. Not one single one has signed on this bill. Not one. Even though my own senator co-authored it, not one single House rep from Texas has signed on this bill. Why? Because we don't need it. So it's a very hard sell for me. Um, Everything's political. They're like, well, why should I sign on that? I need to make sure that I just don't sign on to anything that, might not look good for me. I'm signing on to stuff, that, I need to save that for, they don't want to sign on to anything that might be on the wrong side of an argument later on.
Yeah.
So they pick and choose what they sign on to. And since we don't need this in our state, they've kind of dismissed me at this point. I don't want to say that entirely. I have gotten some good feedback from some of our reps, but they're very nice and then they don't sign on, or they ask a lot of questions. They say, give me your material. They say, come meet me in my office, and I drive halfway across the state of Texas, which is no small drive.
Right.
And then they don't sign on to the bill. So it's really easier for me to fly to DC and knock on 38 doors than it is to drive to 38 reps,
Yeah.
around
Well,
the state of
we
Texas.
do have the Essential Support Persons Act that was signed in 24, went into effect. I believe it did go into effect immediately. So we have actually, Department of Public Health for us was tasked with having to communicate what this was going to be looking like through the legislation that was passed in Illinois. And they developed this a quick fax on the essential support person. And so this is what I'm sharing on my screen right now. This is for Illinois. This is what Illinois has done and is active currently in Illinois. So I want to make sure that everybody on this call understands that we do have an essential support person act in Illinois. And they define here what an essential support person is. So you're going to see it. Many of this mirrors what Mary was saying because they used the federal, they actually, because the federal, they were going at it at the time. And what happened in Texas as as a bounce point for what it was going to look like in Illinois. And because Carrie, who Mary mentioned earlier, is a
Mhm.
part of nationally what is going on as well. So she was pivotal in having this pass in Illinois. So an essential support person is defined as somebody to provide assistance with activities of daily living. And it's physical, emotional, psychological, and socialization support for residents of a long-term care facility. And in Illinois, you can designate one person, and then you can have a primary, you can have a backup person designated as well. So know that. The facilities that are included in Illinois, Mary did say that federally, it's only those that are being supported by Medicare, funding, but in Illinois, it applies to all long-term care communities. So in Illinois, people that do not, communities that do not get federal funding include our specialized mental health facilities that are places for people that have mental illness. And then also we have supportive living facilities, which are similar to an assisted living, but they do allow people that have Medicaid. They receive Medicaid funding, so they're not so that they are also part of all of this as well. Um, so it went into effect in June of 2023. And what you need to do, and everybody on this call needs to be doing this, is to designate a person. It gets designated. Your facility
Mhm.
should be putting this into the care plan. Remember, we always say about care plans, you can always ask for a copy of that care plan so that you can make sure that this information is there. The building is supposed to, upon admission, encourage that person to designate somebody as a primary and secondary essential support person. So that's supposed to be happening. I don't know. This is so new for people, even though it was 2023. It's still new for people because this just came out in the spring. This flyer just came out in the spring. Because, like Mary was saying, federally, they had 2 years to write up what this was going to look like, how it's going to play out. That's what happened here in Illinois as well.
Yeah.
So, this is the flyer. This will be posted as well on our website. I did try to Google it on IDPH's website. I could not find it. Karen or Stephen, I don't know if you can have better luck. There was a link, but it was a broken link. So I couldn't, because I was hoping that we could get that put into the chat, but it is not
Hey,
there.
Lee, I think was able to find
Thank you.
alternate path. So
Okay,
I put
great.
various resources about essential support giving at the federal and state level, as well
Okay.
as general resources for caregivers and how to do advocacy and contact your elected officials.
Great. Thank you. Really, I appreciate that. See, these people that work behind the scenes are amazing. You guys, thank you so much. And then on the flyer, what I did like about the flyer is it's very specific there. If you're being denied access, this is who you should be calling, and we're the very first person there. And
Yeah.
they give the contact. If you these are links that could be clicked on. And then if you don't have that, there's also always, they give the QR code, which will bring you to IDPH's website. It brings you basically to their informational page of their website. So you do have to do some searching there to be able to go a little bit deeper. But you can always reach out to your long-term care ombudsman about this as well. I did want to make sure that everybody did understand that as a long-term care resident, you should be doing this. Please do it for yourself. You have that right to be able to do it. So I wanted to make sure that everybody was aware of this. Um,
This is an excellent, excellent bill. Carrie did work on this.
yes,
I did see it in progress. She sent me her notes and we compared it to the Texas bill. So I am familiar with it. I do know it is a very, very good statute. I also do know though, like I said, you're one of the 49 states that HHS can push the pause button on. So
right.
the
That's what
federal
makes
bill
us.
matters to you, but you
Yeah,
do
it
have
does.
great legislation in place and any type of local state emergency that is in place, you guys are in a really good place. So anytime any facility says, "Oh, you can't come in because we've got scabies," you guys are so protected.
Yeah. Whoops. There is another thing that I did want to share because we are doing a series about power of attorneys, and I'm looking for that flyer. It should be, here we go. So you should be able to see it on my screen in a second. Can you guys see a flyer? So we are doing, the Illinois Ombudsman Program has partnered with the Illinois Department of Public Health, as well as the Illinois Guardianship and Advocacy Commission to do a webinar series that will be starting in June. So our first meeting is next week, June 3rd. And this information is on our website. It's on our Facebook page. But just you can go to our website. You could also always email me and I can give you this information as well. No need to register. It's done just the way we do these Zoom meetings. You get the Zoom link is here on the flyer. You can scan that QR code. It will take you right into the meeting. So it's a series of 3 meetings. One is understanding guardianship. And so that's going to be just understanding all the different types of guardianship out there, what that entails, what that looks like, why you would or wouldn't want to go down that path. Understanding advanced directives, making sure that you have your documents in place for that. And then understanding supportive decision making, which is another avenue to have people help assist them in making decisions. This is where you have a person that helps you make decisions. They do not make the decisions for you. And that will be being discussed as well. I will be also involved in presenting these using that ombudsman perspective of how we as ombudsmen support each of these as well. So I want to encourage people, these are just about the speakers. So I do want to encourage people to attend these because we really, these are going to be very informational for people. I know this guardianship can be a really confusing thing for people. Advanced directives, just understanding all of that. What does a power of attorney mean? All these different people get confused about this stuff. What's the difference between a power of attorney and a guardian? All of these things will be discussed in detail. So I want to encourage everybody, and we're doing them on Tuesday. The first one is the 3rd Wednesdays. We're doing it for 3 Wednesdays. It's actually 2 Wednesdays and a Thursday, I believe. Nope, we did all Wednesdays. All Wednesdays with one skipped in between on the 17th. So grab a cup of coffee, a snack, come and join us for these meetings. We did make them an hour and a half to be able to give time for people to be able to ask questions. So they will be an open meeting like we do these meetings. So
Hey,
share
Lee.
this far and wide for people.
Hey, Lee,
Okay.
it's Karen again. I just wanted people to understand every adult should have a power of attorney, but the key is communicating with the agent of the power of attorney
And
and
that will all
making
be, yep.
sure that your wishes remain current because relationships change, your health changes, your finance change, but it is a way for you to document how you want your decisions to be handled in the event you are not able to take action on your own.
Thank you. Thank you for that. Yes. And that's really good information. And they'll be just, like I said, we'll be able to go into that nice deep dive, and it's going to be from the experts. They'll be sharing that information, and I will be talking from that ombudsman perspective as well. So we're excited about that series that we're actually doing it in partnership with two other Illinois government agencies, which is really a great path to be able to do that everybody showing we're all on the same page, all hearing that same messaging. Mary, I do want to thank you. It was amazing, all this information. I want to give you a hand for all the work and the consciousness that you've brought to this. Just, if the worst thing happens and it doesn't get passed, you've raised a level of consciousness across our country. And know that. I pray and hope that it does get passed federally because it is such a needed thing. But the awareness that has been brought because of you and the work of others like you is just amazing. Good luck in DC. We'll do
Thank
whatever
you.
we can here in Illinois to be able to support you. I
Thank
mean,
you.
I'm going to stop the recording, but we will stay on in case anybody does have any question that they would
Okay.
like to ask.